If you look close enough, you'll see them. The faces. Lost somehow in the headlines of Houston's prosperity. While the rest of the city is thriving, they suffer, and their numbers are growing.
It's very easy for when you drive a nice car, live in a nice community, that you drive on a direct route and you don't see poverty to your left or to your right. And so because you don't see it, it doesn't exist.
Can you pack both of this?
These workers know differently. They've been delivering lunches to hungry children for the past 14 years. In that time, the number of poor children in Harris County has jumped 60% to 300,000.
Bye, Mommy. Bye-bye.
Dee can only reach a fraction of them.
Oh, okay, she got evicted.
Wherever she turns, they are waiting for the only meal most will get all day.
I'm gonna get candy, boss.
Getting this close to this kind of pain is tough. Dee has to keep reminding herself this is not a third world country. This is Houston.
Can't get no better.
It's a side of the city most don't see.
They're not knowing what's going on right here. Where I come every day and I have to listen, I have to be strong.
Christine lives just off the Hardy Tollway. She has 4 boys and $50 every 2 weeks to spend on food. No beds, only donated toys, and barely any clothes. It's why Raymond is still home and not in school.
When I went to enrolling, they asked me, did he have any clothes? And I told them no. He said, well, how's he going to go to school if he ain't got no clothes? So I just came home.
The boys don't know any other life, but when they are hungry, this mother caves in.
Sometimes they bug me so much that I run to the other room because I can't deal with it.
The children are no longer in places you'd expect.
I go home thinking every night about them.
They are hidden away all across this city. Advocates say if children are the future, the challenge is to keep trying to find them. Carolyn Mungo, 11 Up Close.
Now, 11 News at 10.
Houston's low immunization rate, among the worst in the country, is something the city's not proud about. An estimated 30% of the kids here are behind on their shots. But as 11 News reporter Carolyn Mungo tells us in tonight's Up Close report, something called the health buggy may put the wheels in motion for progress.
Ashitaka. Hi.
Margarita Sloan is used to doing well baby checks in an office setting.
He doesn't have any fever. It's normal.
As a nurse practitioner, it's what she's trained to do.
Okay, let's turn him around.
But in these last few months, she's realized it's not nearly enough. Every afternoon, Sloan and her assistant hit the road.
It's Houston, but when you get out into the surrounding areas, it becomes a third world country.
How many children are all together there, Watiana? Do you know?
Quiet, Amber, Ashley, and Treya.
The health buggy
And David, and Warren, and Jeremy.
goes door to door, trying to tackle the horrifying rate of immunizations in the city. In 1999, Houston had the lowest rate of any city in the nation.
It's 2 years old, isn't she?
One look at this home,
There is another child back there.
and you begin to find out why.
He think that he gonna have to go to the hospital, so he hide.
Even though there are 8 city health clinics and 40 mobile sites that offer immunizations, too many families just don't make it there.
She's behind the diphtheria, the tetanus, the meningitis, the polio.
Shonda Thompson's 2-year-old hasn't had a shot in a year and a half.
We don't have transportation. I don't have babysitters. And people around here, they don't take you nowhere unless you got $10 or $15. And I ain't got no money.
You hold her hands, okay?
The other 6 children who live here are in school. Sloan assumes they must be up to date. She is wrong.
They haven't seen anything.
They haven't said anything yet?
No, ma'am.
Sloan will come back after school.
All right, we'll see you then.
She has no choice.
It can be overwhelming when you go in situations like that, but it's not a isolated case.
There is confusion about access and a lack of knowledge about the deadly implications of going without. Inside this trailer, they find Maida, who is almost 4. She hasn't had an updated shot in 3 years. The living room turns into a doctor's office. Most anything will do.
The Health Buggy concept was started by the group Kid Care, but private donations can only pay for one practitioner. This month, its administrator is pushing it citywide.
We're going to rally the medical community, retired physicians, retired registered nurses or LVNs who have kept their licenses up, and literally sweep, as an army of medical personnel, sweep the communities, going door by door and immunizing every child in each household.
Any community effort that can go out educating parents about immunizations is important.
Immunization Director Judy Bloom says the city is already working to improve rates through a new computerized immunization registry. It keeps track of records no matter how many clinics kids go to. But the effort assumes everyone makes it to a clinic. On the streets,
It's a long upward battle.
these workers say they know better. Carolyn Mungo, 11 Up Close.
Meetings are scheduled for later this week with the Department of Health to discuss a partnership with the Health Buggy. The goal is to see the concept expand.